As in previous years, this year as well, members of Armenian American Health Professionals Organization gathered together for AAPHO's annual General Assembly. The meeting began with the election of temporary chairman and secretary for the day's program. The impressive agenda for the meeting included annual reports of the officers and standing committees, amendment to the bylaws, election of new board of directors, and discussion about organization's unfinished and new business. AAPHO's president, Dr. Lawrence Najarian, welcomed the attendees and after making opening comments, invited Dr. Nikolajian to make remarks. Dr. Kalajian just returned from Armenia, where she was on humanitarian mission. She shared her experience and discussed mental problems and suicide level in Armenia.
Suicide is increasing in the ages between 40 and 65 due to high unemployment. There are some towns like Gumri and Ardashad and other places that unemployment is more than 50%. You don't see any men in the town. It looks like it's haunted because they're gone into Russia and other parts of Europe and America to make money, and then women and children are left. Women are caring for children and the elderly as well. So Kiev bridge is called the suicide bridge. Teenagers are kind of using that and copycatting too to follow one another. And the UN had reported this. We started this work in 2014. We have the top 10 collaborators. Minister of Health, they're confirmed it that it's urgent, timely, and immediately needs to be put in place. Then the USAID, then UNDP, then UNF. WHO was saying to me, it's really shocking to me, he said, that Armenia doesn't have a hotline. He's just posted there for WHO, World Health Organization. And he wants this immediately, and they're hoping that by October 10th, when it's World International Mental Health Day, that we can launch a suicide hotline.
Other AAPHO members who made remarks included Dr. Garbis Baidar, who presented annual treasurer report. The medical workshops within our community was discussed by Dr. Knarik Khachaturian Meir. One of the original founders of AAPHO, pharmacist Khoren Nalbandian, spoke about the dream of establishing an organization to serve health needs of the community. Dr. Garbis Baidar and Dr. Lena Merjanian spoke about medical mentoring initiative and mentoring advisory programs. Dr. Kim Hekimian updated the audience with the list of AAPHO's upcoming events, followed by closing thoughts delivered by Dr. Rafi Hovanesian.
This is our annual meeting. It's an event we always look forward to. It's a chance to review all of the projects that we've done over the last year. Human nature is days go by, day by day, week by week, and you really don't feel like you're accomplishing much, but we are truly amazed at how hardworking people, very creative people, have donated thousands of hours of their time to join AAPHO and help increase the awareness, public health awareness of how people can take better care of themselves, how we've shared our knowledge with our colleagues in Armenia, how we've helped improve the health of our brethren here in the tri-state area as well as in Armenia. It's really, truly remarkable what this group has done. And I think our strength derives from the diversity of our membership. We have nurses, we have social workers, we have nutritionists and acupuncturists, we have physicians and dentists of all stripes. And together, we work to provide healthcare solutions for those that need it most. And this has really been a privilege serving as president of this organization. And I'm confident that we have an infrastructure that will really take us to many, many more good places in the years to come.
It's very impressive. I see these individuals thinking, arguing, talking with each other, and just trying to see how they can help their own communities here in America, as well as how they can help in Armenia. It's very inspiring to see this group of individuals. I'm happy to be associated with them. You know, we're very lucky. We're all healthcare professionals here, and it's time that we think about dedicating a little bit of our time to improve the less fortunate, whether it's in our communities, whether it's in Armenia. I'm interested in the CME activities that they're talking about, these educational sessions that we were discussing today. The Armenia mission is something that I will like to get involved with in future years.
This is my first time joining AAPHO meeting, and I'm becoming a member of AAPHO, and I'm planning on joining the mission to Armenia this year. So I was very impressed with all the work that AAPHO does for our community here as well as in Armenia, and hoping to become a part of this mission.
The robust agenda presented at the General Assembly stands as a testimony to AAPHO's continued strength. This vital medical organization works to improve healthcare awareness, increase disease prevention and early detection, foster fellowship and career development of Armenian healthcare professionals, and provide medical support and education for both our local communities and Armenia.
I would like to invite anyone out there who is interested in coming to Armenia with us. We have a medical mission program that starts on June 26th and until July 5th this summer. We're looking for both medical and layman volunteers who'd like to come and help us see patients and extend medical care out in rural Armenia. We'll be both in a hospital setting along with clinics that are scattered throughout the countryside. It's also a chance to see the country a little bit and get to experience things that you may not experience coming to Armenia as just a tourist. If you are interested, please contact us at the mission@apho.org.